Just like we have the bones that were divided in the axial and the appendicular skeleton, we can also divide the muscles into appendicular and axial. And it's the same thing. The axial is your core. The appendicular, everything that hangs off of it. Okay? So axial muscles are muscles that position the head and the vertebral column, and muscles that position or move the rib cage. Your appendicular muscles, they stabilize or move the appendicular skeleton, everything that hangs off from the center. Get that. Okay, so axial muscles can be placed into 4 groups based on their location or function. You have muscles of the head and neck, muscles of the vertebral column, oblique and rectus muscles. Oblique muscles are at an angle. Rectus are the muscles inside on your abdomen, straight up. Excuse me, and muscles of the pelvic floor. Those are your 4 locations. Okay, the groups of muscles of the head and neck are your muscles of facial expression, your extraocular muscles, muscles of mastication, muscles of the tongue, muscles of the pharynx, and anterior muscles of the neck. Okay, that's your head and neck muscles. Okay, muscles of facial expression. Okay, we'll learn all these muscles, show exactly where they're located. You'll be able to identify each one of them and what they do. The buccinator, the depressor labii inferioris, the levator labii. Is there a question? No. The levator labii superioris, the orbicularis oris, the levator anguli oris, depressor anguli oris, zygomaticus major, zygomaticus minor, rizoris, and mentalis. Okay, you can see where all these are located. Okay, this is the buccinator. Buccinator runs along the sides. Let me put maybe green color. We'll show up a little better here. You can see your buccinator muscle right through here. Okay, and that runs along the sides, around the buccal surface of the teeth. That's your buccinator. You get your levator labii superioris. This lifts the upper lip. Okay, zygomaticus minor is most anterior. Zygomaticus major is the posterior. Okay, those attach to the zygomatic bone, the arch, the zygomatic arch. Okay, you've got your, I think I skipped one, levator anguli oris, which is right in between the zygomatic muscles here. That's this one right in there. Okay, you got your orbicularis oris. Okay, orbicularis just means circular muscle, and the oris means it surrounds the mouth. Orbicularis oculi surrounds the eye. Orbicularis oris surrounds the mouth. They're both circular muscles. Mentalis is the muscles right to the chin. Okay, depressor labii inferioris. Okay, depresses or pulls down the lower lip. Okay, depressor anguli oris. Okay, pulls down the angles of the mouth. Okay. These are some of the attachment points that you can see. The levator labii superioris, you can see where it attaches up below the inferior border of the eye socket. Okay, you got your origins and you got your insertions. The origins are red, insertions are in blue. You can see where the mentalis muscle originates from. The mentalis, the tip of the chin, the depressor anguli and depressor labii inferioris, how they all attach to the chin. Buccinator attaches to the back of the maxilla. Okay, and you see your attachment to your zygomaticus minor and zygomaticus major. On your exams, like nursing exams, remember the zygomaticus minor is always superior to the zygomaticus major. The zygomaticus major is inferior to it, below it. Okay. Muscles of facial expression around the eye. You have the corrugator supercilii, levator palpebrae superioris, and the orbicularis oculi. And again, orbicularis means circular muscle, means a circle. Oculi means eye. Oris means mouth. Okay, so it's a circular muscle around the eye, orbicularis oculi. So here's your orbicularis oculi. It's a circular muscle around the eye. These are your corrugated supercilium muscles. Again, allow you to flex above the eyebrow. Okay. You have a levator palpebrae superioris muscle. Let's see, this is attached right across up in here. Okay. That lifts the palpebrae. The palpebrae is your eyelid. It's Latin for eyelid. So levator means it elevates it, and it's a muscle on top, superioris muscle. So levator palpebrae superioris muscle. So you don't necessarily have to memorize everything, but if you can look at the words, you can figure out where they attach and what their function is. A lot of times it actually does make sense. And again, this is the attachment point of the levator palpebrae superioris. And remember that when the muscle contracts, it only can pull, it only can shorten. So it only can pull in one direction. Because all a muscle can do is shorten. All it can do is contract. It pulls upon its long axis. Okay. Facial expression of the nose, the procerus and the nasalis muscle. Here's your procerus muscle, right between the corrugator supercilium muscles. And this is your procerus muscle. That's the muscle you go after with Botox. When you're doing Botox, you're going to give injections. Well, you give injections here, 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 and then you do here and here. That's what gives you the eyes that lift. That's what gives people the eyebrows that come up, is when you do Botox, you hit the procerus muscle, what you're going after. You paralyze that muscle and you don't get the wrinkling up in your forehead. And that's one of the effects of Botox. Okay. And the nasalis muscle is a muscle that goes across the bridge of the nose. So the procerus muscle and the nasalis muscle are the two muscles of the nose. Okay. Occipitofrontalis muscle. Okay, now think about the word. You have the most posterior bone in your skull is your occipital bone. The most anterior bone is your frontal bone. So now we have a muscle, the occipitofrontalis muscle. It runs from the back of the skull, from your occipital bone to your frontal bone. So it runs over the top of your skull. Okay. There's a frontal belly, which is where it attaches to the frontalis bone, the frontal bone. And there's an occipital belly, where it attaches to the occipital bone. Okay. So it's a muscle goes in, it spans your entire skull. And then you have a temporal parietus muscle attached between your temporal bones and your parietal bones. Okay. So if you look at the names, you can tell where they're attachments to. Okay. Here's a temporal parietus muscle right here. And you can see it connects it when it's just reflected right in here, but it connects the parietal bone and the temporal bone. And this is your occipital frontalis muscle. This all right here, this whole thing. And you can see all this. This is the frontal part, and it wraps around behind the skull. That's the occipital part. So there's two parts to it, but it's one muscle that encases the top of the skull. This is just a better view of it. This is the occipital frontalis muscle. This is the occipital portion right here. And this muscle runs to here. And this is the frontal portion here. Okay. So again, you don't have to memorize occipital frontalis muscle is this. You know it's occipital, attaches occipital bone, and frontalis attaches to the frontal bone. Okay. And when muscles connect to muscles, what's that called? It's not a tendon, it's not a ligament, it's called a?
Aponeurosis.
Perfect, it's an aponeurosis. Muscle to muscle attachments is an aponeurosis, and that's what this muscle is. And this is the connection points right here. You can see this is the aponeurosis that connects the two portions of the occipital frontalis muscle. All right, muscle in the neck, you have the platysma muscle, which is that spans down your entire neck below that. Okay, and this you can see the platysma muscle, it starts up in this area here, and it runs down the entire area of your neck. Okay, and your muscles can only contract to make themselves shorter. So you know when this muscle contracts, you know what it's going to do. You can see how it's going to pull. You can see its line of action. We'll talk about line of actions in just a little bit. You can see how it's going to work. All right, so who's been paying attention? There's a list on the left-hand side of all the choices, and the top box, what's that pointing to? Look at the list you have.
The frontal belly of the occipitofrontalis.
Perfect. Frontal belly, occipitofrontalis muscle. Okay. You can see the muscles in red. You can see the aponeuroses are in white. On the back part of that, that's the occipital belly of the occipital frontalis muscle. All right. Second box, what's that pointing to?
The corrugator superciliary.
Perfect. Okay. Corrugator superciliary muscle. Okay. And then the next box points to the side there, which is the
Yeah.
Temporalis.
Yeah.
temporal. Yeah, that's the temporalis muscle, right? That's on the temporal bone. Okay. And the other muscle has been cut away, the temporal parietus muscle. You can see it on the other side. You can see what's been cut away right here. Same thing on both sides. That's your temporalis muscle. And the next one, what's it pointed out? That's circular muscle. So it's circular, it's what?
Orbicularis.
Yeah, orbicularis oculi.
Oculi.
Or-
It's eye, right? Oris is mouth, oculi is eye. So orbicularis oculi. Perfect. Okay. Next one, bridge of the nose is what muscle?
Nasalis.
Nosalis.
Perfect. I know it's not on here, but the muscle above the nasalis, what's this one right here we use for Botox? It's not on the list.
Procerus? Procerus?
Yep, procerus muscle. Perfect. That's when you get with Botox. That wrinkles your forehead when your muscle contracts. So when it's
That's the only reason why I remembered that one.
Yep, so it wrinkles your forehead. So when you paralyze it with Botox, it gets rid of your wrinkles. That's how it works. All right, what's the next one pointing to? There's two muscles there.
Zygomaticus minor.
Perfect.
Minor.
Zygomaticus minor is when it attaches to the superior part, the superior muscle attached to the zygomatic bone. And the one below it would be the
Major.
Zygomaticus major.
perfect, zygomaticus major. Okay, the circular muscle around the mouth.
Orbicularis.
Orbicularis.
Oris.
Orbicularis oris. Okay, and what's the next one pointing to? One on the side. I don't think we talked about that one yet.
Where's it at?
It's right. It's pointing to this muscle. Right?
Rhizorius.
Yeah, it's one we haven't really talked about. Controls the angle right there. That's the rhizoris muscle. Okay, and the next one we talked about, what is this? This muscle originates up here and extends down the entire part of your neck. What muscle is that?
Platysma. I don't know how to say that.
What does it start with?
P.
Yep, platysma. Perfect. Platysma muscle. You're not graded on pronunciations. That's okay. And the next one, right here, the chin. Muscle
The
comes-
mentalis cut.
Perfect. That's mentalis muscle. You see where it's been cut.
Mhm.
And we haven't talked about this yet, but this will be the only one that's left over, which is what?
Thyroid cartilage of the larynx.
of the-
The one without a line through it. That's your
Dang
thyroid,
it, Jonathan.
thyroid cartilage of the larynx. And we'll talk about those later on. That's what keeps your thyroid open. We'll talk about that a little bit before one of the other chapters. All right. So extraocular muscles of the eye, muscles that are on the outside of the eye. They're extrinsic muscles, muscles that control your eye movement. You have medial and lateral rectus muscles. You have superior and inferior rectus muscles. And you have superior and inferior oblique muscles. All that means is you can move your eye medial and laterally. You can move your eye up and down. And you can move your eye at all the different angles that your eye goes through. It has a wide range of muscles that connect to it, so it can move in all kinds of directions. Okay? And you got your superior oblique muscle. You can see the superior oblique. See where this comes across right up here, and see how it comes up, attaches here. You have your superior rectus muscle, which comes in here. And you can see, this is where it attaches, where that point is. This is the end point. When this muscle contracts, what's the eye gonna do? What movement is gonna make? Perfect. It's gonna go up, right? Because that muscle can only get shorter. You can't do anything with the muscle. All the muscle can do is get shorter. So you can see exactly what it's gonna do. It's gonna take this eye and it's gonna rotate it up. That's your superior rectus. Your lateral rectus, you see it attaches right here and right here. When it contracts, this muscle gets shorter. So it pulls in that direction. So which way does it move your eye?
This one would go right.
Yeah, lateral.
Yes.
It'd be right for the right eye, left for the left eye. But it would go lateral, away from the midline. That's a lateral rectus. Okay, the inferior oblique is at an angle. So it moves your eye at an angle and rotates it through the different motions. And then the inferior rectus, that's going to pull the eye down. So you can look at the attachment sites and you can see which way it's going to go, because you realize that muscles can only do one thing. When they contract, they get shorter. They can't do anything else. And they're going to contract along the long axis of the muscle. And they're going to move whatever they're attached to along that pathway. So just by looking at it, knowing where it attaches, you can know what movements it's going to make. And that's how they named it. I mean, lateral rectus moves the eye laterally. Superior rectus moves the eye up superiorly. Inferior rectus moves the eye down. Inferior oblique moves it at an angle. It actually kind of makes sense. Medial rectus, you can see the medial rectus here as this one contracts. This is going to pull the eye medially towards the midline. Okay, like Jonathan was saying, for the right eye, it's going to move left. The left eye is going to do right. All right, so the lateral, this is just what we talked about. Same stuff we've done, except now it puts it out in English words. So the lateral rectus rotates the eye laterally. Medial rectus rotates it medially. The superior goes up, inferior goes down. The superior oblique rotates it downward and laterally. The inferior oblique rotates it upward and laterally. So it rotates at an oblique angle. So you got many movements that the eyeball can make for vision. Muscles of mastication. Chewing. Masseter is your main muscle of mastication. Okay, this is your main muscle that allows you to chew. Okay. The average person bites with about 300 PSI, pounds per square inch. Okay, that's a lot of force. The average denture wearer bites with 5 PSI. That's a big difference. Now you got to think about it. If you like to eat, keep a hold of your teeth, because you have no force when you bite with a denture. And then look at the size of them. They cover a lot. 70% of your taste buds are covered by denture. So food doesn't taste anymore for you. Okay. If you like the taste of food, enjoy to eat, make sure to keep your teeth. Okay. Because the reason is, if teeth are anchored to the bone. Bones are solid. You can bite. You have something anchoring it. Dentures do what? Dentures rest on soft tissue. There's no anchor. Okay. So when you bite, they're getting into a spongy substance. There's going to be no force there. Okay. So remember, humans can bite about 300 PSI. Average dentures right about 5. That's a huge difference. You're looking at it. And that's due to the masseter muscle. That's your main muscle of mastication. Temporalis muscle is muscle on the side. This muscle, okay, the temporalis connects the temporal bowels to the mandible. Okay, that's what's responsible for migraines. This one is it doesn't directly cause migraines, but it's a muscle that contributes to the development of the migraine. It allows the teeth to clench, and once the teeth clench, there's grooves and they can lock in there, and that groove can be transmitted into the TMJ and up into the skull. And that's what gives you your migraines. We make night guards that help prevent that, allows the teeth to slide so they can't clench. And that's one of the ways to treat migraines. Okay. Pterygoids are the muscles that allow the jaw to go side to side. Not a lot of power there, but allows movement to the side, like when you're chewing. When you chew, it's not a straight up and down motion. It's a sideways, it's a cyclical motion. And the pterygoids are allowed to pull sideways. So those are your 3 muscles of mastication. Again, the main one is your masseter. Okay. And here's the masseter muscle. You can see this huge thing here slings wrong computer. Slings all the way down to the mandible. Okay. Temporalis, you can see where it connects up in here. You can see if that muscle is stressed. Okay. That's the muscle that's going to cause migraines up into the head, up into the skull, up in that area. Okay. The pterygoids, you can see on the side, these muscles constrict. And again, if you look at the way the muscle is situated, you can see that if the muscle pulls to the side, it's going to cause the mandible to move to the side. Okay, you got medial and lateral pterygoids. This helps move it medially, and these move it laterally. Okay, you can see the masseter and the temporalis on the previous slide. Okay, what they're going to do is they're going to slam that jaw shut. This is a little bit more of an angle, but this one here, this is all up and down. The masseter muscle is completely up and down for it to do it when it constricts. And that's its function. That's how it's going to function. All right, this tells you a little bit about the different muscles. It tells you the masseter muscle elevates the mandible, closes your jaw. Okay, it assists in protracting and retracting the mandible and move the muscle side to side a little bit. The temporalis elevates your mandible, closes the jaw, assists in retracting and moving the mandible from side to side, and the pterygoids. Those really move the mandible side to side, and they're the weaker muscles. The bigger ones are the masseter muscles, and the temporalis. The smaller muscles are the pterygoids, medial and lateral pterygoids. Muscles of the tongue. Tongue is one of the strongest muscles in the human body. Okay, we do that trying to hold that down all the time. We're doing filling, so we don't hit people's tongues. But tongues can really put on a lot of force there. You have the genioglossus, the hyoglossus, palatal-glossus, and the styloglossus. And you can tell where they connect to. The genioid bone, the hyoid bone, the palatal bone, and the styloid bone. And glossus means tongue. So looking at the names, you can tell where they connect. Okay. The hyoglossus, here's your hyoid bone. Right here. Okay. So the hyoglossus connects to the hyoid bone to the tongue. Genioglossus, geniotubercle, the mandible, connects up to the tongue. Styloglossus, styloid process. Okay. And the palatal-glossus, this connects up here, up into the hard palate. Okay. Those are all muscles that control movements of the tongue. Okay. So the genioglossus depresses and protracts the tongue. The hyoglossus depresses and retracts the tongue. The palatal-glossus elevates the tongue, depresses your soft palate. Okay, and the styloglossus retracts the tongue and elevates the sides of your tongue. Muscles of the pharynx. Okay, you've got superior, middle, and inferior constrictor muscles, and they all act to constrict the pharynx, just at different locations. Okay, so here's your superior pharyngeal muscles. Here's your middle pharyngeal muscles and your inferior pharyngeal muscles. Now look at the long axis of each one of those. They're all functioning in the same direction. They're all going to constrict the pharynx. Okay, because remember, all the muscle can do is shrink, contract. Okay, and each one of them, you can see it's going to pull this tighter. This is going to, you can see how the fibers are running. Okay, the only difference is where it's going to constrict at. The superior constricts the top, middle towards the middle, and the inferior towards the bottom, towards the esophagus. So you have your superior, middle, and inferior pharyngeal constrictors. Okay, laryngeal elevators. They elevate the larynx of the pharynx. You got the palatal pharyngeus, the salpingopharyngeus, and the stylopharyngeus. Okay, and you can see where they're located. The stylopharyngeus muscle here, you can see how it's going to elevate it, lift it up. Palatal pharyngeus. Notice the direction of the fibers. They're running 90 degrees roughly or perpendicular to the constrictor muscles. So looking at the muscles, even if you didn't know their names, you know what they're going to do. You can see the constrictor going to close that space. You can see the stylopharyngeus and the palatal pharyngeus are going to lift that space and open it up. They're elevators. Okay? And you can get that by looking at the muscle's direction. And there's the salpingopharyngeus. Again, same thing. It's going to pull and elevate that area, elevate the pharynx. Palatal muscles, muscles of your palate. You have levator veli palatini and tensor veli palatini. Okay, here's your levator, which goes up, and your tensor, which goes up. Just going to be different areas. One's going to tense the palate, one's going to elevate it. Muscles of most of the neck, anterior muscles of the neck. All right, you have a digastric muscle. You have an anterior belly of the digastric and a posterior belly of the digastric. And you can see the two here. This is the digastric muscle. Slings across here, goes through this little pulley, this little sling right there, and it extends across back to the mandible. Okay, there's an anterior belly and a posterior belly. And when it contracts, you can see it's going to pull this down and pull across here. Okay, and that's your digastric muscle, anterior and posterior bellies of it. Sternocleidomastoid muscle. Okay, without looking at it, what are the 3 points of attachment of this muscle?
The sternum,
Sternum, clavicle,
Mastoid.
Mastoid process. That's where it's going to attach. It's in the name. This is the sterno. That's attaching to your yeah, I'm back here. There's your three attachments right here. Okay, you can see it attaches to the clavicle, comes up here, attaches to the mastoid, and attaches to this the clavicle, the sternum. Not a real good picture of it. Let me do this here. A little bit better. Okay, this right here attaches to the clavicle. The sternum, I'm sorry. This is where your sternum attaches. This is where your clavicle attaches. And this is where it attaches to the mastoid bone, mastoid process. You see 3 points of attachment. Maybe the next one gets a little bit better. No, that's just the 3 attachment points. So it attaches to your mastoid process, attaches to your clavicle, let's run across here, and then to the manubrium of the sternum. There's a sternocleidomastoid muscle. Okay, muscles of the back. Muscles of the back form 3 distinct layers. There's a superficial layer, there is an intermediate layer, and there is a deep layer. Okay? The superficial layer is the extrinsic back muscles that move the neck. The intermediate layer is your extrinsic back muscles that move the vertebral column. Your deep layer are the intrinsic back muscles that interconnect the vertebrae. So the muscles that are between the vertebrae are deep. Going out from that, you have muscles that move the vertebral column. Going out from that, you have muscles that move your neck. So it's just layers of going from the superficial layer and inwards to the deep layer. That's how they're arranged. Examples of superficial muscles of the back are your trapezius, latissimus dorsi, levator scapulae, and the rhomboid muscles, both minor and major. Okay. So here's your trapezius muscle. And again, it gets its name because it's shaped like a trapezoid. That's your trapezius muscle. Okay, both right and left sides. Okay, latissimus dorsi, muscles that run along your side right here. Okay, you have a rhomboid minor and a rhomboid major. The rhomboid minor is anterior, just like the zymaticus minor and major, and the rhomboid major is inferior. Okay, and you have your levator scapulae, which connects to your scapula and allows you to raise or elevate the scapula, elevate your shoulder joint. Okay, so the levator scapula attaches to the scapula. Some names don't have any, you can't tell where they're attached to, like the trapezius muscle. That's just the name that, it just because the shape looks like a trapezoid. That's what its name is. Okay. Intermediate extracted muscles are your serratus posterior muscles. The serratus posterior muscles run, okay, this is how they run along the side here. I sit on both sides here. Serratus posterior muscles are these muscles that run along the side. Now, you can see the muscles reflected here. Okay, so underneath those are your rhomboids. Minor is on top, major is on bottom. That's your rhomboid minor, rhomboid major. Underneath those, because those control your neck. Underneath those are your intermediate muscles, your serratus anterior. Those control your spinal cord, allow you twisting of your spinal column. And the deep ones. Remember, the deep layers are the ones that go allow in between your vertebrae. Okay, and you have different deep layer muscles. You have your superficial intrinsic, your intermediate intrinsic, and your deep intrinsic. Okay, those are between your vertebrae. Okay, muscles can also be grouped in different manners. They can group into cervical muscles, thoracic muscles, and abdominal muscles. Cervical muscles are up around the neck, your cervical vertebrae, C1 through C7. Thoracic muscles go around your rib cage, T1 through T12. Abdominal muscles go along your lumbar vertebrae, L1 through L5. Okay. You can have oblique muscles that don't just go up and down, but they add an angle when you twist. Those are your scaling muscles. You have anterior, middle, and posterior scaling muscles. Those allow you to rotate around the spinal cord. They're at an oblique angle. They elevate the ribs and they flex the neck. Okay. And here's your anterior, your middle, and your posterior scaling muscles. Okay, when they contract, they allow this area to move and pull and twist. And those are your deep muscles. Okay, those are your spinal flexor muscles. Okay, oblique muscles in the thoracic region. Okay, you have external intercostal muscles that elevate your ribs. Okay, so these elevate the ribs. You have internal intercostals, which depress the ribs. Okay, and you have transverse thoracics, which depress the ribs. Okay, they have different functions during breathing. You can see here's your internal intercostals. Costal means ribs, and these are internal intercostals between the ribs. Okay, that's where they're located. Those are your internal intercostals, and your external intercostals are these out here on the outside of the costage cartilage of the ribs. So internal intercostals, and this is the diaphragm across here, and your transverse thoracics are internal and on top of the abdomen. Okay, so the serratus posterior is in the thoracic region. Okay, you have the superior serratus and the inferior serratus. Okay, so superior serratus posterior and inferior serratus posterior. The superior serratus posterior elevates ribs, enlarges the thoracic cavity. Okay, so does that aid the diaphragm or inhibit the diaphragm? What's the
Aid.
function? Aid, perfect. Because when the diaphragm contracts, it increases the thoracic cavity, the size of it, allows the lungs to expand and air to flow in. So this helps the superior serratus posterior, that helps elevate the ribs, which enlarge it, pulls up and enlarges the thoracic cavity. The inferior serratus posterior are the exact opposite of the diaphragm. They force air out. Okay, they allow you to blow out birthday candles, things like that. Okay, they depress the ribs, opposes diaphragm contractions, and decreases the thoracic size. That's what forces air out of your lungs. Okay, without that, you have the conditions of COPD. Because the diaphragm only does one thing. Remember, the muscles only move one way. So when the diaphragm contracts, it enlarges the cavity. Then it just relaxes. There's no force to relaxing a muscle. So you could not force air out. What forces air out is the inferior serratus posterior muscles. Those allow you to contract, and now you have a contraction that decreases the size of the thoracic cavity, so it decreases the volume of your lungs and forces air out of your lungs, and allows you to forcibly blow birthday candles out. Okay, because the diaphragm can't do that. Because diaphragm can't contract both ways. I mean, you can't contract and pull air in, contract, push air out. Okay, you only got one way to go with muscles. And when the diaphragm contracts, it pulls the diaphragm downward, allows the thoracic cavity to enlarge, and air to flow in. When the diaphragm relaxes, the air can flow out. When you compress it with the inferior serratus posterior muscles, okay, that shrinks the diaphragm, that shrinks the thoracic cavity, and decreases thoracic size, decreasing the lungs, forcing air out. Okay, so here's your serratus posterior inferiors, and you can see when they contract, they're going to pull this direction. They're going to pull the ribs down and decrease the thoracic size. These are the serratus posterior superior muscles. You can see when they contract, they're going to pull the ribs up, okay? Increasing the thoracic side and assisting the diaphragm. So the serratus posterior superiors aid the diaphragm. The serratus posterior inferiors go against it, the exact opposite of the diaphragm. You also have oblique muscles, the abdominal region. You have the external obliques, which flexes or rotates your vertebral column. You have your internal obliques, which rotates your vertebral column. And you have your transverse abdominis, which compresses the abdomen. Okay, so this is a cross section of you like on a CAT scan or an MRI. And you got the transverse abdominis muscle, which is right here. And when this contracts, okay, you have your external oblique on the very outside and the internal oblique inside of that. And that's where they're located. They're circular muscles around the edge of your abdominal cavity. The rectus muscles. You have a geniohyoid, an omohyoid, a sternohyoid, and a thyrohyoid. Those are the rectus muscles in the cervical and the neck region. Okay, you can see where they're located. The geniohyoid contracts up here. There's the genioid tubercle, attaches to the mandible there, and comes down attached to the hyoid bone. Hyoid. Good. Comes from the hyoid bone and comes over the thyroid gland. Okay. Sternohyoid connects to the sternum, to the manubrium of the sternum here. And the omohyoid has a superior and an anterior belly as it runs up. Okay. Those are the cervical neck muscles. The rectic muscles are the diaphragm. It expands the thoracic cavity. So when the diaphragm contracts, the thoracic cavity expands. Your lungs expand to fill the space. Air flows in. You've decreased the pressure. For those taking chemistry, you know that pressure and volume is always a constant relationship. As you increase the pressure, as you expand the volume, you decrease the pressure. Therefore, the pressure outside the body is greater than the pressure inside. Air flows in. That's how it works. Simple chemistry. This is your diaphragm muscle. This huge thing right here. See, when it contracts, it pulls downwards. It increases the volume of the thoracic cavity, allows the lungs to expand. You can see all the red is a muscle, and you see the tendon right here where it connects. Okay. The rectus abdominis, those flex the vertebral column, divided longitudinally by the linea alba, and it's divided transversely, what's called tendinous inscriptions. These are the things you work on when you want to audition for the movie 300. Okay. All those guys had unbelievable six packs. Okay. These are the muscles that give you that. Okay. This is your linea alba. Linea alba went straight down the middle. Okay. The tendinous inscriptions are the lines that define each rectus abdominis muscles to give you your six pack. That's your tendinous inscriptions. And these muscles here, these are your rectus abdominis muscles. Like I said, you define them by increasing the linea alba and the tendinous inscriptions around it as you develop each of those muscles. Okay. Again, you take away the outer skin. This is the linea alba. Linea alba strict means white line in Latin. Linea alba, white line. It's a white line that runs straight down the middle. Okay. The rectus abdominis are all these groups of muscles right here. It's this muscle. Okay. And then the tendinous inscriptions are the tendons between each of these sets of muscles. And you can see, look at them. Look at where the tendons attach. What's going to happen when those muscles contract? This is going to get shorter. So it's going to punch out and pull out and pull out. And you're going to get muscles that pop out. And you're going to get your six pack or your eight pack, depending how much you work out. Okay? But that's the ones that, those are the muscles that are responsible for the rectus abdominis. Then your tendinous inscriptions run sideways, linea alba runs straight up and down. Muscles of the perineum and the pelvic diaphragm. I'm getting lower as we go here. Main functions are support the organs of the pelvic cavity, flex the joints of the sacrum and the coccyx, remember where those are located, and control the movement of material through the urethra and through the anus, liquid and solid evacuation from the body. Okay. The perineum is the pelvic floor. It's divided into two triangles, a urogenital triangle and an anal triangle. Those are the two triangles of the pelvic floor. Okay. They're separated by what's called a superficial transverse perineal muscle. Learn that muscle. It is on every nursing exam, every NCLEX that has been given. I don't know why. On all the ones I've reviewed, they always ask what muscle divides the two triangles of the pelvic floor. Always. It's one muscle that's right across the middle, and it separates the urogenital triangle from the anal triangle. And it's been on every NCLEX that I've reviewed, and all the ones that I have copies of. And it'll be on your test too, if that's not enough incentive for you, right? So no, the superficial transverse perineal muscle. It's superficial because it's on the top of it. It's transverse because it runs side to side, and it divides the perineum into the two triangles. So superficial transverse perineal muscle. And I'll show you what it looks like. And here it is. Dun, da, da, da. This is a superficial, I'm on the wrong screen. Superficial transverse, and it runs on both sides. And it divides the urogenital triangle, is up here, and the anal triangle. That's its function. That's what the muscle divides. Okay. Again, and the superficial transverse perineal, this was, oh, I'm going backwards. Okay, this was female, and this one was male. But it's the same muscle, okay? The superficial transverse perineal muscle divides your urogenital triangle and the anal triangle in both male and females.
They look like they attach and go in different directions.
What do you mean?
Like come from female to male. Maybe it's just the way the pictures are, but like male was pointing backwards and female was pointing forwards. If you
Get rid of the marks there. Yeah, on the one of the females cut away, so it's kind of hard to see. But you can see how it kind of divides up there. And the one of the male,
it looks like it goes back and attaches more towards.
it's probably a lower attachment on the males. Okay, due to the presence of the vagina and the urethra being in two different places. So probably it's a lower attachment on the males and the females. But it's still the same muscle that divides these two triangles. It's when it goes right between them. But it does appear on the way the picture is angled that the male is a little bit lower attachment than the female one. So you got muscles of the pelvic floor. Okay. You get the superficial urogenital triangle muscles on the outside of it, the superficial transverse perineal, which I said divides the urogenital triangle and the anal triangle, the ischiocavernosus muscle, and the bulbospongiosus muscle. Okay, then you got deep urogenital triangle muscles, are the deep transverse peritoneal instead of the superficial, and the external urethral sphincter. Now the external urethral sphincter, you have an internal and external. The external sphincter muscles are under voluntary control. The internal ones are not. Okay, they're under autonomic muscle control. So these are under voluntary control. You control the external urethral sphincter. Okay. Again, this is the female. You can see the external urethral sphincter. Again, voluntary control for urination, and the deep transverse perineal. Okay. You can also see the superficial transverse perineal muscle. That's superficial. And this is the bulbospongiosis. This is one that forms like a bulb shape here. And the ischiocavernosus on the side. Okay, the anal triangle. The coccygeus muscle, the levator ani, which is the iliococcygeus muscle, and the pubococcygeus muscle, and the external anal sphincter. Again, external anal sphincter is under voluntary control. Okay. So here's your pubococcygeus muscle, your iliococcygeus, run to the side here, and your external anal sphincter. Again, sphincter muscle is a circular muscle. And the external ones are under voluntary control. And then the coccygeus muscle on the outer ridge there.